Go team.
Okay, we are recording, and I'm going to click start webinar right now, and we'll give it 15 to 30 seconds. Here we go.
All right, good morning, everyone. I hope everybody has had the opportunity to join. I can't see I expected to be able to see the attendees, but I can't, so that's okay. Welcome and good morning. Thank you all so much for joining us this morning, snowy morning, and this week for our senior symposium titled Learning and Caring for Yourself During Your Senior Years. My name is Sam Doherty. I'm a community health promoter with the North Bay Parry Sound District Health Unit. I will be your host for this morning's session, but we'll also introduce some of my planning team members as well momentarily. My pronouns are she and her, and I am going to go through a couple of quick housekeeping items before we get started here. So we are recording today's session. Everybody's cameras are turned off, but just for your...
Sorry, it was supposed to be put on administrative. Wait a minute, I'm turning my radio.
We do ask that everybody keep their microphones muted unless you have the opportunity to ask a question, which we can call. I think everybody's videos are automatically turned off, but Kelsey, could you perhaps confirm that? I'm just reading a chat box note here. Perfect, thank you so much. So all videos are off, so you don't have to worry about that. The session will be recorded so that people can come, who weren't able to attend, can come back and listen later. If you have any questions for the presenters at any point in time, you can feel free to put it in the chat box. There should be a little chat function on your screen. If you have any questions, if you have any technical issues, you can also put those into the chat box. Our tech person named Josh will be able to answer some of those questions. Yes, from the background, everybody will be muted as well. So if you accidentally turn your microphone on, we can mute it from the background, but just so you are aware, there is an option to turn your microphone on if you do have questions, but we ask that you give us a heads up in the chat box, and then we can just pause the presentation to be able to let you speak. What else am I missing here? There is a closed captioning option. We were kind of trying to figure it out as we were getting started today, but there should be a CC button on your screen that would let you allow you to start.
I threw you off. Nope. Didn't think so.
Sorry, I just asked that everybody just keep their microphones muted for the presentation, just to eliminate background noise. Thank you so much. All right, so this is our agenda for this morning. We've already kind of done our welcome, done our little housekeeping. I'm going to just do a quick land acknowledgement. We're going to do some introductions to our planning committee. We're going to have an overview of aging in Nipissing and Parry Sound. We're just going to do a quick review for the week, go through some more IT troubleshooting pieces, and then I'm going to introduce you to our keynote speaker, who is Dr. Sullivan, and she should be starting around 9:30, so you don't have to listen to me for too long. So before I get started, I just want to acknowledge that we're hosting today's meeting on the land that has been inhabited by Indigenous peoples since time immemorial. The North Bay Parry Sound District Health Unit, which is where I'm located, where I work, sits on the traditional territory of the Anishinaabe people within the lands protected by the Robinson-Huron Treaty of 1850, which are used by the members of the Nipissing First Nation. We acknowledge that we are also situated on the unceded territory of the Algonquin Nation and settlements of the Métis Nation. Today, I personally, on this snowy day, I'm working from home, as you can see in my video. And I'm situated in Simcoe County on the traditional lands of the Anishinaabe people, which includes the Ojibwe, Ottawa, and Potawatomi nations, collectively known as the Three Fires Confederacy. And I'm located on the traditional territory of the Huron-Wendat and the historic homelands of the Métis. As individuals and organizations, we are committed to moving forward in the spirit of truth, reconciliation, and respect with all Métis and Indigenous peoples. So I'm just going to take a few minutes to introduce the Planning Committee. So today's presentation is brought to you by a whole group of people who have spent some time providing guidance and direction in the planning, one of which is the Stay on Your Feet Committee, but I'll chat about that in a second. I'm first going to let Michelin from Canador introduce the Village Project.
Good morning, everyone, and welcome. Thank you for being patient with us as we have a virtual symposium. I know that it's not the best format. We really hope that we'll be able to welcome you to the village in June of 2022 for an in-person seniors event where we'll get to meet each other and not have to use technology in this way. But just to let you know, Canador is really proud to be supporting this event and working with this team. The Canador College has built the village on campus, and the village has a goal of becoming a center of excellence in healthy aging in the community. So you're going to hear more and more about the village and Canador in the months to come. And we would just like to welcome you. And if for any reason you'd like to find out more about the village, there'll be opportunities to reach out to us, and there'll be a presentation also later this week. So thank you and welcome.
Thanks so much, Michelin. I know we had a quick chat with the other planning committee members, but I will provide just a moment of opportunity for folks to introduce themselves if they would like to. So as I mentioned, other planning committee members include Homestead, the Health Unit, the AIDS Committee of North Bay and Area, the New Horizons for Seniors program, Nipissing Wellness Ontario Health Team, Helpline, CareLink Advantage. And all of us are part of what is called the Stay on Your Feet Coalition, which is a regional strategy that's implemented across the Northeast with the ultimate goal to improve the quality of life of older adults by reducing their rate, risk, and severity of falls. We've recently pivoted away from just focusing on only falls prevention, but as some of you might know, November is Falls Prevention Month, so that is why we chose November for our symposium. But we have moved towards a more holistic approach to healthy aging, and our three main themes include let's be active, let's be social, and let's be strong. And throughout the week, you're going to hear a lot of presentations and information that fall within each of these three themes. I am hoping this will work well, but we have a quick welcome from MP Anthony Rota, and I'm just going to play it here.
Hello, bonjour, Annie. This is Anthony Rota, Member of Parliament for Nipissing Timiskaming. I would like to welcome all the guests to this week's Senior Care Symposium, and I want to congratulate the organizers at Canador College for hosting this event. Learning and caring for yourself during your senior years is what this symposium is all about. And that is such an important topic, especially as more of our population enters that age demographic. We need to find ways to be able to provide that information. And that's why I'm so pleased to see so many of the community resources being contributed to this week's event, including Homestead, CareLink, Advantage, West Nipissing Community Health Center, the North Bay Parry Sound District Health Unit, and many more. Seniors care is a priority for the Government of Canada, and with New Horizons for Seniors program in place, we are able to provide funding for projects that make a difference in the lives of seniors in our community. Throughout the week, you will hear panel discussions on some of these programs and opportunities that are available. You'll get information from local service providers who can give support to those who are looking to live independently longer. These kinds of collaborations are so important because when we bring together everyone who is trying to make a difference, we get the best information available and pass it along to those who are seeking that information. Again, I want to welcome you and thank you for taking the time to be here today. Thank you. Merci. Miigwech.
All right, thank you to Anthony Rota for providing that welcome. I'm going to go into a little bit, just really high level overview of aging in locally in our region of Parry Sound. But before I get started, we do have another welcome from Dr. Chirico from the Health Unit.
Hello, my name is Dr. Jim Chirico, the Medical Officer of Health for the North Bay Parry Sound District Health Unit. I have the esteemed pleasure of welcoming you all to this year's senior symposium called Learning and Caring for Yourself during your senior years. As many of you already know, November is Fall Prevention Month. In our district, roughly 22% of the population is 65 and older. Falls are the leading cause of injury-related death, hospitalization, and emergency department visits for older adults in Canada. Many day-to-day activities can affect the risk, rate, and severity of falls, including things like nutrition, social isolation, and physical activity. We know that the COVID-19 pandemic created additional barriers for people to not only access services, but also everyday necessities such as grocery shopping and socialization. The Health Unit conducted a survey to learn more about the barriers and impacts of COVID-19 pandemic on those 65 years and older. We learned that 49% of respondents were less physically active since the start of the pandemic, and 69% of respondents reported experiencing more feelings of loneliness or isolation. Although I don't think these numbers are surprising, it is important that we do something about it. So this week is about you, whether you are someone 65 and older or a caregiver. The agenda is packed with learning opportunities to help with healthy aging, addressing the barriers and impacts of COVID-19 pandemic, and staying independent. So thank you for joining.
Thank you for that overview from Dr. Chirico. And a lot of the pieces that I have here were touched on by Dr. Chirico just a moment ago, so I won't go into a lot of detail. But as mentioned, our population here in Nipissing Parry Sound is about just under 125,000, with about 22.5% of that population being 65 or older. And that's actually projected to rise in the next 20 years to about 33.4%. Some common concerns that older adults face locally within our region include chronic diseases such as COPD and asthma, inadequate fruits and vegetables, especially during the winter months, physical activity, so ensuring that everybody can get the appropriate amount of physical activity, which is about 150 minutes per week. As Dr. Chirico mentioned, in a survey that we did recently, 49% of older adults have identified as not meeting their physical activity requirements, partially due to the impacts of COVID-19, as well as living alone, which increases social isolation. As Dr. Chirico mentioned, falls are the leading cause of injury-related death, hospitalization, emergency department visits in Canada for older adults, and we locally are actually above the Ontario average for the number of falls-related emergency department visits. So just an important piece to note when we're thinking about the importance of this week's symposium. Over the course of this week, we're going to provide you with lots of opportunities to learn about healthy aging as well as falls prevention, including many topics such as social isolation, which I'm going to pass the mic over to Dr. Sullivan in just a few moments to chat about. The other pieces that you can expect from this week will include education sessions, which are 30 minutes to 1 hour webinar style, kind of like we're in today. They're learning opportunities to where experts in their field will provide opportunity to provide education opportunities for different topics related to healthy aging within our community. And there will be lots of opportunities throughout the week to ask questions. We will also have panel discussions, which are about 1.5 hours, and they bring together professionals in different fields to talk about the supports and services that are available locally to older adults within our communities. The panels were originally developed as a way for us, because we can't come together in person, to try to get the sense of like booths that you might be able to come up to, ask questions from different providers, get resources and information. So that was our hope for those panel discussions, as well as the education sessions to provide different learning opportunities. This is a busy slide, but this is our agenda for the week. These are all of our education sessions. So today we have organizing our living room chairs, social connectedness, and positive solitude. Tomorrow we have some information on money management, the medicine wheel, benefits of retirement living, storytelling. On Wednesday, we have introductions to dementia and communication, as well as planning to age at home. On Thursday, we have the current state of isolation in our region, as well as brain and behavior with the Alzheimer's Society, and then some personal medical technology to support aging at home and on the go. And then finally, on Friday, we have considerations for healthy aging and fall prevention, as well as a focus group, which will help provide us some opportunity to hear from you about what you liked best about this week and how we can move forward in the future. I do feel like there's actually one missing for Friday. There's another on Thursday, sorry, a presentation around COVID and influenza from the health unit.
And Sam, there's another panel as well on,
Sorry.
I think it's Tuesday.
Yeah, sorry. So the panels are actually on this slide. So
I'm sorry.
Those were our education sessions. Our panel discussions will happen Monday, Tuesday, Wednesday, and Friday. Those panels include physical activity, health and nutrition, which is today, this afternoon. On Tuesday, there's a digital literacy and technology panel. Wednesday, there will be an aging at home supports panel. And then Friday will be social participation groups and clubs. So lots of opportunities for learning and engaging with local services to answer all of your questions. If you see any sessions that you would still like to register but haven't just yet, you can connect with Stephanie. So my colleague at Canador, she will be able to provide support to register for any sessions that you might have missed. As well as you can continue to register independently online for each individual session at our symposium website, which is here. If you have any IT issues throughout the week, Kelsey will be able to support you through those, both through the chat box, as I mentioned, as well as via email or phone. So Kelsey is happy to provide any support that way. And finally, as I'm sure everybody's tired of hearing me talk about all the logistics side of things, I'm going to turn it over to Dr. Sullivan. So Dr. Sullivan will be presenting, as I mentioned, on organizing our living room chairs, social connectedness, and positive solitude. Dr. Sullivan is a registered social worker and professor of social work and social gerontology at Nipissing University. Her research focuses on the social context of aging and older age. You can find her complete bio on our symposium website that I just mentioned, and we can throw in the chat box again for folks. And thanks so much, Dr. Sullivan, for joining. I am going to stop sharing my screen and turn it over to you.
Okay, thanks very much. Let me now start sharing my screen and hope that host has disabled participant screen sharing. I need to be made a co-host, I guess.
Okay.
You should have the go ahead now, Mary Beth.
Okay, there we go. So I'm going to put things up and you tell me if it's all okay. Can you see that clearly?
Looking good.
Looks great.
Okay, perfect. Okay. Well, thanks very much for joining me this early Monday morning, and thanks very much to my colleagues at Canador's The Village for the invitation to participate in which sounds like a wonderful week of learning opportunities as we think about aging and our older age. This morning, I want to think about social connectedness and positive solitude via our living room chairs, and carefully think about our desire to engage in quality connections throughout our life and positive solitude, both of which are contributors to well-being or good health in our life, across our life course, and as we age. Now, before I get to our living room chairs, I need to set out why these chairs are important in the first place. And so I want to start with making 4 points that are relevant to both social connection and positive solitude, and why we should be thinking about this during our lives as well as during our aging years. So the 4 points I want to walk through very briefly are the UN's Decade for Healthy Aging, life expectancy, the life course and social determinants of health, and positive age beliefs. And so these thoughts are helping us to develop our thoughts around connection and solitude and their relationship to what I'm calling well-being, but you may think of as good health overall. So just very briefly, here are the UN's Decade of Healthy Aging's 4 strategic pillars. And I really encourage you, if you have the time, to just go on the WHO website and have a read through this document. But this decade is really about targeting various areas in terms of thinking about aging and older age, and addressing the issues that might impact on our ability to maintain our well-being in later life, and impact on our ability to maintain our social connections as we age. Now, the second point is about our life expectancy. So the Public Health Agency of Canada in 2020 nicely set out our life expectancy. So as you probably know, our life expectancy has increased considerably since the 20th century. Now, we've had a bit of a dip recently due to the opioid crisis and COVID, but otherwise in Canada, we're in pretty good shape. So according to this graph, in 2017, if I was 65 years of age, I could expect to live another 21 years. However, our health adjusted life expectancy, or the age we can expect to live in relatively good health, is somewhat lower. So let me reword that. So when I'm 65, I can expect to live on average to the age of 86. However, I can only expect to live in good health until the age of 80. So therefore, I can expect to live at least 6 years in poor or declining health. Now, living 6 years in poor or declining health is not ideal for any of us, right? Our desire is to live healthily till the moment we die. So we need to think or ask ourselves, how can I shrink those numbers of years that I'm in poor health? Or how can I postpone the onset of poor health? Now, the third point is that our well-being as we age is related to our entire life course. So some of our health status is set down earlier in life when we're born via our DNA. But much of the development of our functional abilities, so for example, muscle strength, and its decline as we age is related to lifestyle factors. Now, this is similarly so for our psychological or our social health. So lifestyle factors such as exercise or how much alcohol we drink, or our engagement with friends and community, can also impact on us from our earlier life through our life course and into our older years. So some people, for example, from their childhood, they're joiners or they're outgoing people. And you might have other people who are more, we often call them as loners, or they're not sociable people. Now, what we have less control over is perhaps things like living in poverty or being ostracized for being different or experiencing discrimination or racism and so forth. Now, these too will impact on our physical and psychological and social health as we age. And we will feel the impact of that, but we might have less control over that. So the point here is that our socioeconomic situation, for example, and choices or decisions we make across our life course are particularly important as we age. So we might not be able to change our overall socioeconomic status, but we can make lifestyle changes at any time to increase the likelihood of living longer and living longer in good health. And my fourth point is that there can be no shortage of positive images or messages around aging and older age. And there are a couple of related points here. So we need to be really critical of ageist and stereotypical media portrayals of older people and messages that perpetuate inaccurate representations of aging. So for example, here on the right, I'm showing you headlines that are suggesting that we have a new pandemic of an increasing number of older, lonely people. Now I'm going to return to that in a minute. We also, though, need to generate more positive age beliefs within ourselves. So more recently, we have studies by Levy and colleague coming out of Yale University that is telling us that many young people have beliefs about aging that aren't reflected in the experiences of older people. And if we hold more positive age beliefs about aging, then we can improve our experience of aging. So this is basically what we know as a self-fulfilling prophecy. So if I think I'm going to age well, then I may age well, because that might motivate me to make lifestyle choices as much as I can to live well. Okay. So now, keeping those points in mind, let's explore social connectedness and solitude. So we know that loneliness, social isolation, being alone, and solitude are important considerations for our well-being or for good health. These are slightly different concepts that can overlap, and we sometimes use them interchangeably, despite them being very different things. But more recent research tells us that we know that for most of us, we will experience some of this at some point in our life. They are not typically problematic for our health because they're not prolonged experiences or we've learned how to cope with them. But for a small minority of people, these will become problematic and negatively impact on somebody's well-being. So let's just unpack these a little bit. So social isolation, or the lack of connectedness, means that our social networks have diminished, or that we're physically separated from our family and friends. So think about our children moving away, or our friends that go to Florida for the winter and we stay home, or we have a bout of illness that prevents us from joining, say, our bridge club or our golf tournament, or just meeting up with a friend for coffee. The social isolation is an objective measure in that it tells us how many connections we have. Now, importantly, isolation, though, may lead to loneliness for some. Now, I'm only going to address social loneliness today. So I have on my slide emotional existential loneliness, but I'm not going to particularly address that. So social loneliness is when we have few social connections, but more importantly, we're dissatisfied with the quality of these connections or these relationships. So it's a subjective assessment about our circumstances and our connections. Now, a comment that many older people tell me when I research this area is The common thing of calling up a friend over the phone and all the friend does is talk about themselves. Or trying to find people that have similar interests to me. Common problems that people experience, not just in later life, but throughout our lives. So being socially connected and having the right connections to suit us is important for our well-being. And we can make some choices or take actions from time to time to be sure we check in on this aspect of our health. Now, solitude is the state of voluntarily being alone. Now, while this might provoke some anxiety for some, it's thought to be actually a good thing for us all. So even if we're living alone, we can decide to use this solitude to a positive end. Now, like loneliness, this is also a subjective experience. So a lot of people assume that both social isolation and social loneliness are a normal part of aging. But we now know through various and a multitude of research studies that it isn't a normal part of aging, but it can become a problem for some. We also know that these experiences, as I mentioned earlier, can happen at any stage in our life. And another important point to remember is that most people will experience these things for fleeting periods of time, that they're not necessarily a permanent state. Okay, let's just look at this a little bit further. So Canada has been really poor in terms of collecting data to help us understand how many people in Canada may be isolated or lonely. We know how many people live alone, but actually knowing the number of people that live alone only tells us the number of people that live alone. We don't know the experience of living alone, right? So I mentioned some people living alone might use that positively in terms of solitude, where others it may be a problem. So the Canadian Longitudinal Study of Aging is a survey that follows a group of people over a long period of time. And from the first wave of this survey, they recently published this article, which looks at just over 30,000 people in Canada between the ages of 45 and 85 and plus, similar number of men and women. And what it tells us, that almost 75% of this sample were neither isolated or lonely. Just over 15% of the sample was isolated. Almost 7% of the sample rated themselves as being lonely, and 3% of the sample rating themselves as being both isolated and lonely. So remember, I told you that social isolation can lead to loneliness. Now, what's really important is that these figures resemble those figures found in other countries, and in particular, the United Kingdom, where they've been studying social isolation and loneliness for many years. And so our numbers here in Canada seem to be fairly consistent. So you can see it's a smaller number of people experiencing isolation, loneliness, or both. However, there are some groups that are more vulnerable. And what I'm showing you here is a chart that talks about and shares with us information on people who are either living with dementia or caring for someone. So we know that this group is particularly vulnerable to experiencing isolation, loneliness. Now, I'm particularly interested in this because this is an area that in both in policy and practice, we don't talk a lot about in terms of people living with dementia or caring for someone with dementia and experiencing either social isolation or loneliness. So this study followed over 2,000 people for an extended period of time. Now, it was collected in the United Kingdom, but it's the most robust data that we have. And what this tells us, if you look at the people that are recorded or indicated here in blue, these are people living with dementia. And what we know is that they're experiencing higher rates of social isolation than the rest of the population. And care partners, indicated by the green bars, are experiencing higher rates of loneliness than the rest of the population. So you might be now thinking in terms of a person living with dementia and their care partner, one being isolated, but the other person being lonely. So when we're thinking about how we manage that, then we might be thinking we need to think of a couple of different strategies to support people in that situation. But we know more in terms of who else is at risk. Now, remember my points in terms of the life course and the social determinants of health early on. Now, this data here comes from a synthesis of data that's completed by an organization that looks at best evidence. And again, it comes from the United Kingdom. Now, we don't have information on social isolation, but we have well-being more generally and loneliness. Now, there's a few important points here for us to think about, particularly throughout our lives, or when we think about ways to help others. So according to this synthesis, health and income are relevant for our well-being and for levels of loneliness, as is our family status. And this is particularly important thing about aging and the number of people that might experience widowhood. And interestingly, a risk for loneliness is our neighborhood, including feeling safe, including accessibility, and trusting others who live in our area. Now, although there are many takeaway messages, we need to look at risk factors and age. And you'll see here that a risk factor for low well-being is middle age, and a risk factor for loneliness is 16 to 24-year-olds. So the point here is that age in of itself isn't necessarily a risk factor for poor well-being or loneliness. We have to think of some of the other risk factors, not just age. So now we know that we need to be in good physical, psychological, and social health to maximize our well-being or our good health. We know that optimal well-being is important across our lives, and that our patterns of living, even from childhood, and our social circumstances can positively or negatively affect our well-being. And as we know, one aspect of our well-being is our social self. And as we transition into older adulthood, our social selves, alongside other aspects of our health, become salient. Now, whilst there are things that society and communities can do to help us along the way in addressing the social context of aging, what can we do for ourselves? And that's what I want to talk about. What can we do for ourselves? What can we do ourselves to improve our social well-being as I age? So I'm borrowing the idea of the living room chairs from a fellow by the name of Henry David Thoreau. And Thoreau was a 19th century naturalist as well as a philosopher. And Thoreau and some of his contemporaries at the time were interested in how we can simplify life, or argued that much of our unhappiness originates in social burdens or unnecessary social burdens in our life. And that things like stress, for example, things that are stressing us out absolutely shouldn't stress us out. So Thoreau proudly reported that he had 3 chairs in his house. He had 1 chair for solitude, 2 chairs were used for his friends, and 3 chairs were used for society, or basically meaning for engagement with larger numbers of people or community. And each chair was equally as important, and we needed to plan on how to use them. So what messages can we take from this when we're thinking about connectedness and solitude? So the first one is living deliberately. So I'm currently working on another project related to dementia, and I met with a group of men who are care partners for wives with frontal temporal dementia. And they shared with me the importance of living deliberately in their circumstances. So what they told me, for example, was that because of their caring responsibilities, they needed to purposefully plan their social connections, their social outings when they connected with others. They also told me that they needed to talk to friends and family to adjust outings to accommodate their caring needs. And they needed to make sure that people be told that if they canceled, it was due to care, it wasn't lack of interest. So this had me thinking and led me to do, and I'm currently doing another project with people, and again, it's people with dementia, but we're actually mapping out their connections. And that's that image on the right that you see. And so I'm having people actually sit down with me and purposefully look at who's around them, connections that might be strengthened, and social connections that they might find draining or stressful. And this is about shredding stress and purposefully mobilizing and maintaining connections in their lives. So in this sense, each chair, the chair for solitude, because people tell me about things they do alone, like connection to reading or taking walks. Our 2 chairs for friends and our 3 chairs for community play an important role when we deliberately plan their use. Now remember that Thoreau had a chair for solitude. And for Thoreau and for many other people, solitude is a positive state. And in fact, back in 1854, Thoreau wrote, "I love to be alone. I never found the companion that was so companionable as solitude." And so many philosophers now and others argue that we need to be alone to get to know ourselves as much as we try to get to know other people. And when we understand ourselves, then we understand the world around us. And solitude is about asking the question, what do I need to do for myself now? Some of you might be familiar with the term mindfulness, and this is not too dissimilar. We should seek solitude to calm our minds, to remove the noise of the world around us, to find joy in reading or listening to music or crafting or carpentry or planting a garden. For some, it may be meditating or journaling, but it's taking time to reflect on our accomplishments from life's lessons and the stories in our lives. Now, I'm taking a little bit of creative liberty with Thoreau's ideas here and suggesting that we also need to take the chairs out of our living room and move them outside. Move them to the outdoors, our connection with blue-green spaces or nature, whether it's on our own with 1 chair or whether it's with others, 3 chairs, is important for our health. Now, we don't have a lot of literature that explores this, but there's a growing body of research, and the WHO again recently published an evidence review to suggest that our connection to nature is good for our mental health, that it can be restorative, it can help us remove stress from our lives, and it makes us subjectively feel better. And when I feel better, I do more and I can connect. And if we're physically active in those spaces, well, then that's even better. So thinking about being with nature. Now, if we can't get outside, it may be through a window, being in our garden or in a city park. Using all of our senses in all of the seasons and looking at the sky during the day and looking at the sky at night and the joy that that can bring. Now, I've been working, as I said, on a number of studies looking at loneliness. And this quote here is from a woman who was struggling with loneliness in later life, but she drew my attention to nature and why I'm more interested in this now. And she told me, I look at what I can see now, trees, and you can get a certain amount of strength, inner strength from looking at nature. I like them best when they've got no leaves on and the wind is movement. I seem to look at it and think life's not too bad. Look, even when they're not dressed, they're still there, and the strength. They are strong trees, the weight that they bear. And dandelions, to me, the most magnificent. You go and you chop them down, and 2 days later, oh yes, they're back. So the using of nature to help her understand her current circumstances and find strength through nature. Now, just to wrap up, when I talk about our living in chairs, I'm reminded of a television show from my childhood that many of you might know called The Friendly Giant. And if you remember, the Friendly Giant offered at the outset of each episode a little chair for one of you, an armchair for two more to curl up in, and for someone who likes to rock, a rocking chair in the middle. As a young child, we were invited into the Friendly Giant's stories expressed through his connections with Jerome and Rusty and others. And those connections became my connections, even when I was watching this show alone. Now, I'll leave you with one final thought about connectedness and solitude. I took this picture of this older woman in a wheelchair when I was visiting St. Mary's Magdalene Church in Sandringham. This is the church where Queen Elizabeth goes for her Christmas service each year. Now, this is quite a familiar image that we typically, the media and others typically use to represent isolation and loneliness in later life. Now, she indeed was isolated and excluded from the experience of visiting the chapel because the chapel wasn't wheelchair accessible. Well, there's another type of chair, but anyways, it wasn't wheelchair accessible. But when I spoke to her, she framed this in another way for me. She said that I'm spending time feeling the warmth of the sunshine on my body and watching the sheep in the distant pasture. And she was looking forward for her friends to show her the pictures from inside the chapel that they would take. So these are two stories from the same picture. And I'll leave you with that to think about as your day goes on. So thanks very much for listening, merci and miigwech, and please do get in touch with me at any time if you have any questions or you'd like to ask more about the research I'm doing. Thanks again.
Thanks so much, Dr. Sullivan. That was a really great presentation, really insightful. I know we have a couple minutes. I just want to give participants an opportunity to ask any questions or provide any comments that you might have. You can feel free to either put them in the chat box, the Q&A box, or if you would like to unmute yourself and ask a question, we can probably make that work. I know it's a little bit tricky over webinar, but.
Thanks, Debbie.
Dr. Sullivan, thank you so much for that perspective. We've been working with various older adults for the last couple of years with the project, and we've heard specifically about the perception in the media about older people, like how older people are being portrayed as frail, as a group of individuals that need to be helped. And there's very few positive images about older adults. And so that part of your presentation really struck me. And I'm sure this is something you hear a lot. And I don't know if you can elaborate a little bit on that, because you talk about the UK experience, but you're seeing the same things here in Canada as you.
Yeah. No, it's just remarkable to me in terms of thinking about how we still portray older age and aging with negative images and negative messages when we know, as you said, and people that I work with, that it's very much not the case for so many people. And what I think I find most alarming is that it's generating fear in younger generations, right? Or the expectation that I'm going to grow old and be miserable and alone and lonely and in pain and not enjoying life. When we know that it's absolutely not the case for so many people, and that there are resources and supports for those that might experience something that's more challenging.
It's such a good point. It does, I'm sure it scares younger people. I never even thought of that perception, right, of it being such a negative experience to grow old.
Yeah.
We do have a question in chat as well. This is from Susan Preeb. How do you find and reach people who are socially isolated and lonely? Finding this group is often a challenge as they don't necessarily reach out.
Yes, you're right. They don't. And I know that I learned early on that you never say, well, I'm offering a presentation to talk about loneliness, because no one will show up, right? Because there's a lot of stigma associated with someone who might be isolated or who might be feeling lonely. Now, the other important point is that we have people who've been socially isolated all their lives. Right. And, you think of our geography, people who've been, who live out in rural or more remote communities and have always been isolated. Now, for some people, that isolation is not problematic, but for some, it is. And so we need to think about, if it is a problem, well, then why is it a problem? And we know, right? And I know Micheline knows this, that a lot of it has to do with transportation in and around the north. Right? Or it has to do with the accessibility to a community where people feel welcome and where they feel safe and where there's something to do. So there's things as a community that we might need to do to draw those people in, to support them. But no, naturally, they're not probably going to reach out to us.
Thanks, Dr. Sullivan. There's lots of great comments coming through the chat box. I see, Harriet, that you have raised your hand and also just put something in the chat box. I wonder if you are able to unmute yourself. And
I'll give Harriet the opportunity to speak, and then we also have another raised hand, Nicole Fournier. So Harriet, I'll allow you to go first, and then Nicole.
Thanks, Kelsey.
Spell check has helped me to make a really big misnomer in my question. Everything you shave, I meant everything you said, resonates with Women 10. And I'm just wondering, and I've been thinking a lot about this lately, if you think that we have developed a North American culture that doesn't support us as we age, believing that we can live to a very full life right to the very end, and that it is from the outside in, but it's also from the inside out.
Right. Yeah. You know what? I don't think this is just a Canadian phenomenon. I mean, I lived in the United Kingdom for many years, and it's an issue there, and I've seen it working with colleagues around the world. Right. That we've been slow to come to think about or to change the chip in terms of how we think about aging and older age. And I know the work of Micheline and colleagues at the Village, beginning to challenge that too. But I think we're coming along because the newer generations of older people, right, or that's another whole debate in terms of when we consider ourselves old, but the newer generations of people who are aging and thinking about aging in younger years than waiting till our later years are beginning to give us examples of how aging and older age is different than we once thought it to be. So we have a growing number of examples here in our community and elsewhere about living our lives to the fullest as long as we can, and even when we're dealing with perhaps a chronic health condition or other things that are slowing us down. So I'm hopeful and positive. I mean, I've been studying older people for many years now, and you can see that people are challenging, right? Those normal images and messages, that's not what it's like for many of us.
Thank you so much, and thanks, Harriet, for that question. We do have a couple more things. I think we hopefully have enough time to get to these couple comments. So there's one comment that says, my sister-in-law is 86, 14 years older than myself, and she can run circles around me in all aspects of what you've noted, Dr. Sullivan.
Yeah, right on, right on.
Another question that came through was, what key differences in your work did you find between working and visiting the UK versus Canada or Ontario-based research?
I think our contexts are overall very similar. United Kingdom has done a lot of work ahead of us in terms of thinking about aging and older age, and particular isolation and loneliness, and things that we can learn from as we critically look at what they've done and actions they've taken in terms of addressing an aging population. But I think although we have unique characteristics in terms of our geography and the diversity within our population, I think there's a lot of messages from that context that resonate here.
So very interesting. I think we are just about at time, and we seem to have answered all the questions. So that was a really great opportunity for folks to answer questions. I think that was fantastic. There's just one final comment about there was a photo voice project done in North Bay, and just how some of your concepts are really captured in the work that they are doing with that as well.
Yes, thank you.
All right, well, not seeing any more questions and recognizing we are just about at 10 o'clock. We timed that quite well today, Dr. Sullivan. So thank you again so much for your participation and your valuable presentation. We really appreciate it. And thank you everybody for joining today. Really appreciate you taking the time out of your morning, and please feel free to continue to register for additional sessions throughout the week, and we hope to see you at some of our later dates. Have a great day, everybody.